My name is Matthew Chung, and I'm a structural and interventional cardiologist with Virginia Cardiovascular Specialists. Growing up as I was going through school, I always found that I really enjoyed my science classes, but I also, in my career, wanted to do something that allowed me to interact with people. And as I was going through college, I really found that being a physician was, to me, really the best combination of really intense science, but also the really personal aspect of being able to relate with other people. And so for me, once I realized that, it was really a no-brainer, and it's something that, as I've gone through my training, I've really enjoyed. I grew up in Grand Blanc, Michigan, and I went over to a small liberal arts college in Pennsylvania. And then from there, I went a little further south to Charlottesville, Virginia, and did my medical school training at the University of Virginia. From there, a little further south, I went to Duke University for my internal medicine residency, and then went out to the Midwest to Washington University in St. Louis for my cardiology and interventional training. And then my final year, I was fortunate to come back to Duke University to do training in structural heart disease. Some people will stay at one institution to do the majority of their training, but I was somebody who kind of went to different places, which was great because I got to really see how medicine is practiced in different parts of the country. You kind of see different approaches to treating the same illness. And I really also developed mentorships that I still have at all these other institutions across the country. So I think for me, it really made me a more well-rounded physician, and it allows me to take better care of my patients. I really strive to be able to hear what my patient is trying to tell me and understand what they're hoping to get out of the treatment and what I can provide for them. Because I think when the patient has a better understanding of what's going on, what there is actually to do about that problem, and they have reasonable expectations for where they can go, then it really empowers them, and it gives them a sense of calmness about what's going on. And it also, I think, better enables them to take better care of themselves. And so for me, it was a no-brainer to join this group, and I've loved working with them every day. Just what we're able to do for our patients as a team, I think we work very well together. We've got well-respected cardiologists that are experts in their field, and it's been fantastic to work with this group. Outside of work, I'm a husband and a dad, and I have a 3-year-old daughter and a 2-year-old son. We'll have our 3rd edition later this fall, so I'll be busy doing that. But other than spending time with my family, we enjoy traveling when we can. My wife and I are also pretty big foodies, and we're very excited about the restaurant scene in Richmond. So I think there's a lot for us to get involved with here in the Richmond community, and we're very excited to join it.